time for our weekly check-in on infectious diseases with Dr. Isaac Bogoch, infectious diseases specialist at UHN. Dr. Bogoch, I've been saying that for almost 5 years now and just completely booted your title. I don't know how that happened. Infectious diseases specialist physician at UHN. There, we'll edit that back in for the whole final remix. So good to see you this morning. Hope you're doing better than I am.
Great to see you, Dick. You're a champ, and I know you can do it.
Okay, here we go. Let's try this. Long COVID, of course, is something a lot of people have been dealing with. You know, they got COVID during the pandemic. They're still dealing with it now. Now, researchers have found what they call some sort of strange structures lurking in the blood of people with long COVID. How could this information help people that are still suffering here?
Yeah, what they're referring to is something called a biomarker. And really, there's a lot of research going on trying to understand who is more prone to long COVID, or what are the indicators for this? What are the risk factors for this? And how do we even identify people with long COVID or other chronic manifestations following acute infection? I know this became, for lack of a better word, more widespread and discussed more broadly after COVID. But this is a phenomenon that's been known for a long time. Some people following an acute infection have chronic manifestations. And the whole point of this is to look at what's called a biomarker, which is basically a chemical test and or looking to detect enzymes, chemicals, anything in the blood that can distinguish people who have these chronic symptoms from those who don't. And the whole goal here is how do we better diagnose this? How do we better manage this? I mean, I think we're still a long way away from having a good understanding of this process, but at least it's a step in the right direction.
Okay, well, that's certainly good to hear. This news was a little more distressing. We were talking about this yesterday, but it's great to have you on. A new report from the Canadian Cancer Society says Canada may not eliminate cervical cancer by 2040. That was the goal. So can you tell us about the link here between HPV and cervical cancer?
Yeah, so HPV is also known as human papilloma virus. It's a very common virus. There's many different types of it, over 100 types of it. Some of the viruses, some of the HPV viruses can lead to cervical cancer or cancers of the head and neck. Other HPV viruses might cause things that are annoying, like genital warts, and other HPV viruses don't do anything as far as we know. But the whole point is that the ones that can cause cancer are very problematic. We have a vaccine for this. This vaccine is routine immunization. It's given in Ontario to those who are in middle school or high school. There's 2 doses. It's given 6 months apart. This vaccine is remarkably effective in protecting against the types of HPV that can lead to cervical cancer and other cancers of the head and neck. We've seen rates plummet across the world in places that have rolled this out, but in Canada, unfortunately, there's a bit of a stubborn plateau in cervical cancers. The Canadian Cancer Society, for example, estimates that in 2025, 1,600 women will be diagnosed with cervical cancer, and about 450 of those women will die. Remember, almost all of these cancers are preventable with HPV vaccination. And the other important point here is to discuss screening for human papilloma virus. And again, with expanding family medicine in Ontario, which we're seeing a huge push to do, we will enable access to this screening more easily. And that's very, very important. So women around the age of 25 should start to be screened for cervical cancer. And again, we need more family docs and broader access to family medicine in Ontario, which is happening. And this will also help save lives, especially related to routine cancer screening.
Gotcha. I don't have much time for this. I'm trying to sneak this next one in there, Dr. Bogoch. An employee at a local Burlington restaurant between October 23rd and November 1st. This employee handles food, has hepatitis A. It's a popular eatery. What should people who ate there at that time be doing, to look for things, and how contagious is Hep A?
Hep A, just to keep it brief, is transmitted. It sounds gross, but this is how it's transmitted. It's through the fecal-oral route. So if this person wasn't washing their hands and other people were at that restaurant, they're at risk for this infection. It's vaccine preventable. If you go and get a vaccine right away, you can prevent hepatitis A infection. It's got a long incubation period. It can be up to 30 days to 60 days. But people who are adults can get very, very sick from this tremendous inflammation of the liver. Younger kids don't get as sick. Adults get very, very sick from this. It's awful. Most will survive, but it's just a terrible infection. Vaccine preventable. So if anyone was exposed to this, get that Hep A vaccine as soon as you can, and you'll be okay.
Sounds kind of nasty. Okay, Dr. Bogoch, we appreciate this. Infectious diseases specialist at UHN. Thanks, doctor. Talk soon.
Have a great day, Nick. Thank you.
See ya.